My contribution to Rural Health People 2030 was the chapter for the issue of chronic pain in rural America. Something we're really passionate about in my office. We see a lot of people that struggle with chronic pain, and as I chat with my residents and they graduate and go practice, they also see quite a bit of chronic pain in their populations. So I thought it'd be a great chapter to author and do research for. Something that really stood out to me while I was researching this topic was honestly that nothing really stood out about it. It's like things that have been known for a while, and the struggles are very present and discussed, especially couched in the housing of the opioid epidemic, because that's where we see a lot of interplay between chronic pain and opioid use disorder. So I've long known that the severity of chronic pain and substance use disorder in rural areas are pretty severe and stark. So it was just confirmed more of what I already knew. 2030, what I hope to see different is a couple things. First of all, we've talked a lot as a country about the opioid epidemic, and I would love to see all of the rural towns that don't have access to someone who's willing to treat patients with opioid use disorder. And a big reason for that is because we see people that have chronic pain end up inappropriately on opioids, and then they develop opioid use disorder. So I think if in the process of educating providers in rural towns about opioid use disorder, I think we also have an opportunity to get them educated about how to treat chronic pain appropriately. So that's the first thing. I think if we treat opioid use disorder, I think we can really see an improvement in chronic pain and how it's managed in rural areas. Another thing would be we know that multimodality treatment is best for chronic pain, and I would love to see more physical therapists, more programs to be for rural areas, specifically people to move there that want to work there, or good referral basis put in place. We focus with chronic pain and substance use disorder primarily on opiates, but I think we need to not hesitate to find ways to intervene in terms of the methamphetamine use that we see that's so prevalent in rural society, as well as things that could be coming with the decriminalization of marijuana and potential side effects and effects of that in the future.